everybody. Today for our short discussion we're going to talk about diabetes. What is diabetes? Diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defects of insulin secretion, insulin action, or it could be both. We are going to discuss about the types of diabetes. There are mainly three types: type 1, type 2 and gestational diabetes. Type 1 is the type where there is no insulin production at all, or the beta cells of the pancreas has been completely distracted, and in that case the patient or the person needs to be on insulin. That's also called insulin dependent diabetes because there's no more insulin produced by the own body, and it's an autoimmune disease. And the next type is type 2. Type 2 diabetes is the adult onset and it's called insulin dependent diabetes, meaning once you have been diagnosed with type 2 diabetes, that means your 50% of the beta cells of your pancreas has been completely distracted, and there's only 50% more is left in your body to function, to produce insulin. So you could be started with the oral medications to begin with, and eventually you might be ending up on insulin. So that's called insulin dependent diabetes, an adult onset. And the third type is gestational diabetes. Gestational diabetes is the one that's been diagnosed during pregnancy time. So it's very important to be monitoring the blood sugars during the pregnancy because there's risk to the mother and the baby. And if you have gestational diabetes, it's very important to check your blood sugars after the delivery. 6 to 8 weeks after, you should be checking your blood sugars, and also every year, because you can get diabetes in next to 5 to 10 years once you have been diagnosed with gestational diabetes. And there's more other kinds of diabetes which is due to some drug use like steroids, and also if there is some defects to the pancreas, you can get diabetes too, because that's going to be causing problems in insulin production. Next, we are going to be discussing about how to diagnose diabetes. There are mainly 4 ways to diagnose diabetes. If your blood sugar is 126 or more first thing in the morning on a fasting base at 2 different occasions, yeah, you could be having diabetes. And if your blood sugar or the hemoglobin A1C, which is a 3 months average of your blood sugar, if it is more than 6.5%, you are having diabetes. Then the third way is to diagnose diabetes is if you have classic symptoms of diabetes plus random blood sugar of more than 200. And the fourth way to diagnose diabetes is after you having or ingesting 75 grams of oral glucose tolerance test, which is some kind of glucose. If your blood sugar is more than 200, after 2 hours of ingesting that 75 grams of oral glucose, if you're, you have diabetes. So these are the main 4 ways to diagnose diabetes. Next, we are going to say about how to diagnose pre-diabetes. Pre-diabetes is a stage before you get diabetes. So if your hemoglobin A1C is 5.7% to 6.4%, you have pre-diabetes. And also if you're impaired fasting glucose, if it is between 100 to 125, you have pre-diabetes. So if you have been diagnosed with pre-diabetes, make sure that you control things that you can control, like watching diet and doing exercise to prevent diabetes. The next is the signs and symptoms of diabetes. Excessive thirst, excessive hunger, excessive fatigue, and excessive urination are the main 4 symptoms of diabetes. So if you're having this, you have to be confirming it with other confirmatory diagnosis measures that we discussed already. And in the next episode, we'll be discussing about management of diabetes and how to manage hypoglycemia. Thank you so much.